You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Ashley Lerman, how are you?
Doing great. Thanks so much for having me.
Thanks for coming. I appreciate your time. I haven't had anybody on the podcast so far with your interest, and I think it's important for people to expose an interesting fact about what you're doing in your career. And we'll go over a few things that you've done so far. But first of all, I want to kind of get your input into quickly tell us your journey. How did you start? What happened in the meantime, and what are you doing now?
Yeah, absolutely. So I'm a board certified pediatric dentist. I finished residency in 2020, which was a strange time. I was at a children's hospital during COVID in the heart of Manhattan. So my last 6 months of residency were a little twisted, but my first job out of residency was extremely busy, seeing very high need patients. And after a year of that, I decided to pivot into an oral health tech company focused on preventing disease from the start for new and expecting families.
Interesting. Why a tech company?
I think that we can leverage technology in a smarter way than we are right now, specifically with the medical dental integration. There's a lot of good data showing that there is oral disease transmission from mother to infant. And if we're able to get into that entry point at a smart time, we can potentially prevent a lot of disease.
Yeah. So this is some sort of an unconventional path, right? So you finish residency, and most of the time people focus on the job, the first job. They want to get the most out of it, eventually go into a, partnership track or academic path or something like this. And you didn't want that. You wanted to be something else. And why? Because you're a woman. You come from New York, where it's a lot of, tech competition. It's a big hub. And you're a mom, and now you want to take over a new business endeavor in a tech company. What's going on? What's the mindset behind this?
Yeah, it's honestly a little bit masochistic. I have a almost 2.5-year-old and a 1-year-old right now. So people look at me and they're like, are you crazy? And like maybe a little bit, but at the end of the day, I can always go back to clinical practice. I have those skills forever. It just felt like the opportunity to take a risk at this point on this massive pain point that I was seeing on such a large scale. And honestly, I was frustrated that patients weren't given this information earlier in a smart way, like with the internet, with social media, with the outreach that we have and the means of communication to people individually. I just saw massive potential in a way that we could shape prevention from the start and actually have a lot of impact on people.
Yeah, it's something that I haven't seen done in many hospitals in my career, and I've done a lot of OB as an anesthesiologist, and I'm very aware of what happens with with a newborn after a C-section, right? And what I would say the education of the mother, regarding the baby care is immediately after that. And I don't remember seeing anything or heard anything about the dental care of the newborn, or for that matter, the dental care of the past dental care of the mother. So, what can you tell us about the relationship that's there that you discovered and you wanted to address?
Yeah, so there's a lot of good data that shows there's a direct correlation between primary caregiver or mom, for example, their oral health status and that of the infant. And we unknowingly or knowingly pass down that bad cavity causing bacteria through our saliva. So if we're kissing baby on the mouth, if we're sharing utensils, if we put the pacifier in our mouth and pass it to our baby, if we can ideally prevent the transmission or at least delay it, we can really have a good outcome on oral care for the infant. There's also some wishy-washy data on correlation between the fetal outcome of pregnant mom and mom's oral health status. So correlation with preeclampsia, gestational diabetes, low birth weight. Idea is that there's some sort of correlation with the inflammation in the mouth and potentially the fetus. But the main point is dentistry in the mouth has been siloed for so long from medicine. So if we can go in and plug in a way that doesn't disrupt the medical flow, I think that's a hole in one and really brings the idea, this holistic in a whole body sense way to care, not in a woo-woo way.
Yeah, yeah. So tell us a little bit about the path that you took, because you have an idea, you notice a gap in care, you think about it, at home, and you come up with this company and idea that addresses the issue. What's happening next after this phase of just being in your head?
Yeah, such a good question. I honestly didn't know what I was going to do. At the end of 2021, I filed officially for the LLC of my company, not knowing how I was going to do this. It's a massive problem to undertake. What I did know is that parents didn't basically know what to use, how to use it, and when. I wanted to boil that down into a consumer friendly way that parents and families could engage with prevention. Because when you're a busy parent or new mom, you're not going online searching preventive oral care. That's just not the case. As a dentist, we tend to see problems once they're established. We don't want that first visit to be problem focused. We actually want it to be prevention focused. So I took all of these things and I leaned into the social media consumer friendly way and created oral care kits and built out a digital oral care companion app. So people actually engaged with it, went onto it, ordered products through it, went to their first dental visit, found their dentist through it. So I wanted to make this platform that was evidence-based and reliable in this day and age of a lot of questions around public health.
I see. So it's some sort of an Expedia of pediatric dentistry.
I like to think of it as oral health overall because dentistry is so siloed, so
Yeah.
is pediatric dentistry especially. But if we could plug a reliable oral health source for physicians and just the medical dental connection, that's what I like to see FirstGrin as.
Interesting. Um, I definitely agree with the prevention part because I think um, from my experience, again, as an anesthesiologist treating and working with pediatric dentists, it's not a fun job. It's not a
Yeah.
fun job to treat those kids at that level of disaster, So prevention is definitely something that needs to be done. And what kind of exposure did you had so far with your company, and how did you choose to promote it? Where do you go with it? How do you try to market the idea and the company and the products? I'm asking this because there are a lot of people out there with your ideas or a similar idea that want to make a product, want to make a company, and they don't know how. How did
Yeah.
you do it?
I think that's such a good question. I also have no business background. I knew I had an idea. I saw a massive pain point. So I cold called a lot of people. I use a lot of social media now with AI and ChatGPT, always asking questions, always learning, always asking for help. But basically, I saw my company working in two ways. So direct to consumer and using like the mom baby registry space as a engaging way to get into the market. People love that. That took off right away. It's just a harder build because it takes time. The other way was going to insurance companies because it obviously benefits them from the prevention standpoint to save money. So I cold called a lot of people, cold messaged on LinkedIn, found a lot of emails, pitched my company. I was able to convince people basically with the data, with my product and small pilots on the one-off direct to consumer side to buy into the idea with pilots. So now we have large scale partnerships with big payers across both medical and dental. And that came from complete uncertainty. I had no idea what I was doing. So what you're saying about people not knowing, like there won't always be the right time. You just have to take that leap and figure it out and be flexible enough to pivot.
What kind of product do you give to moms right now? What's the flagship of your products?
So our hero product is the intro oral care kit. That's what insurance companies are sending to new and expecting parents that delivers to their door. And it's covered similar to how a breast pump is covered. That has a baby mouth cloth. It's called a smile sleeve, which is a patented cloth that I made to wipe the gums. Their first toothbrush, a teether, a little, placard for what to use, how to use it, and when to break it down. And that directs you to the app too. So you know how to use these things. There are tips, tricks, information, and finding a dentist for your visits.
Interesting. And do you have in running the app and the whole information behind it, do you have a medical staff that's addressing these issues and, thinking behind the scene of what you're doing and how you present the information?
Yeah, I love that you asked that. So FirstGrin is just a preventive and education platform. We did partner with a teledental company, Virtual Dental Care. So if someone in a rural community has a child with an abscess and they don't know the next step, the goal is to connect them to a provider remotely, get them the antibiotic, then divert them to an in-person dentist, rather than them going to the emergency room and wasting time, money, stress, all these resources. That becomes a cyclical burden. So my goal was, yes, to educate, prevent, and provide those resources, but also provide follow-up care. So again, that digital platform allows us to do that.
Hmm. And once they get into the app and they have this information, what's the next step for the patient? Do you have like a network of providers that, take those questions or answer them, or it's just only digital?
So it is. It's to a live dentist with a virtual dental care partnership. So they can call and speak to an actual dentist. And that depends on their insurance coverage. If they don't have insurance, there's always the option to pay for it too. The goal is obviously access for everyone and just making it a frictionless experience, because we know that dental care and medical care can lead to a lot of friction, especially when it comes to payers and insurance, that kind of thing.
So do you have to contract with those specific dentists that are taking the calls and, providing basically follow-up care for those patients?
So our partner really oversees all that virtual dental care, and
Mhm.
they're partnered with, they will take every single insurance. Basically, it'll get coded under a regular code, and then they'll divert people to the appropriate dentist.
I see. Okay, so let me go back into your own mindset a little bit,
Sure.
as a person, because I'm curious. How do you get to this level of commitment, business, and kind of I would say, CEO mindset, right? Um, I'm sure you had a lot of success with this so far, but I'm sure this success is based probably on some type of failures along the way. And I wanna extract this from you. Like, what are those examples of things that didn't work out? You learn from them, you maybe change some of them, and you move forward.
Oh, so many. And I think being a doctor, we're so trained to be risk averse that this was a really hard muscle for me to train. And I still have to train it out sometimes, because you just have to be willing to lean into risk and pilot, see what the results are, and then pivot from there. Some of the most obvious ones, when I was first marketing to begin with, I hired out my marketing and it was just such an absolute flop. They were copying people, like total plagiarism. It looked horrible. It was such a headache. I was focusing on building the business and the business plan, whatever that was. And then I was getting these messages like, oh, you're ripping off this contact. And I had no idea what was going on because I was so removed. So it was such a necessary removal, restart from the brand. And I started doing it myself because we do like a lot of influencer marketing. And when I was starting, people were trying to charge $15,000 and I didn't have that in media and like marketing cash. So I leaned into doing it myself and unintentionally built a platform around that. But I think it just helps strengthen the expert face brand and the science behind it. And that's what I'm really passionate about, and getting that through people's doors in this stage and age of misinformation online.
Hmm. Yeah, very interesting. Um, I have to address this question because many people would probably ask, what is the financial side of this? So how did you build the business? Where did you get the money from?
Yeah.
And how do you raise money for something like this?
Such a good question. And again, like I had no business background, so I was asking myself these questions. So when I started, I basically did it as a side gig. I was doing it out of my house, working clinically a few days a week, and then starting to build up FirstGrin. As FirstGrin scaled, I was still working. I told myself I was going to bootstrap this. Still, I'm bootstrapping this. In the beginning, people told me, you're going to need investors, you need a co-founder. And I basically hired out strategically when I had the cash to do so and when I was at a level that I was confident enough to do it. So it's been a slow burn, but it's how I like to run a business. Like I never really wanted to feel pressure from a board for massive growth and then question the mission of the actual company. Like first and foremost is access for everyone, building smiles for families in just a smart way. So it took a long time. Basically, I worked while building my company up until 10 months ago. I have a 10-month-old daughter. That's how I know that. And now I'm doing FirstGrin full time. I worked through both of my maternity leaves on FirstGrin. So it's been an absolute grind, but that's how I've been able to keep it afloat. And actually we're profitable at this point. So it's a good place to be, thankfully.
Interesting. Very nice. Very nice. And do you have partners now, or is just yourself too? Also,
Just my, sorry,
yeah,
just not to cut you off.
yeah.
I have employees. I have 8 employees at this point, just myself making the decisions. And most of our contract work is through payers, through insurance companies. So covered as a value-based add-on benefit for families through employers, or through community baby showers, different types of events that way.
Interesting. Okay. How is to how is to work with the insurance companies?
Everyone gives me that reaction to begin with. It took so long to, I would say, get live and into the world. But at no point has an insurance company written me off and said this is a bad idea. I have all the data. I have a tangible solution for them. So a lot of them are willing to pilot this, which is amazing. It just takes a long time to get to that point. So I know it's really challenging as a provider dealing with insurances. I've seen it from every side, really, every angle. But when it comes to prevention and value-based care, there's a lot of pressure on payers to show that they're leaning into innovation. And that's where I think we've had success with FirstGrin.
Interesting. Nice. So basically, all the contracts that you have right now with insurance companies are directly between you, your company, and them. So they're basically paying you to provide that kind of preventive treatment for their patients, right?
Yes, that's exactly right.
I see. So actually, moving forward with this idea now, you know, again, I'm trying to figure out and deconstruct your mindset a little bit more. What do you think are the better habits and routines that you developed in your own life in to get this off the ground as a young woman, mom, no business experience, and bring this to fruition basically and profitable?
Um, I've always been really regimented. Like I like a schedule, I like routine. I'm really into working out. I was an athlete growing up. I think a lot of the discipline comes from that, to be honest. And I just grew up in a family where education was first and foremost like a big, big, big priority. So I was in a really rigid structure of studying, and I'm not a perfectionist because I don't think you can be if you're an entrepreneur, to be honest. You have to be willing to fail a lot. But I really like results and I like moving forward and I like moving fast. So I think a lot of that translated to different parts of my life too, not just my career, but just personal life too. Like I said, working out, just getting my mind clear. I tend to focus fast and work fast when I'm moving and getting the energy out somehow.
Mhm. And now that you're making this business profitable, is it enough for you to consider this like completely off the ground and you just like, let it go and fly by itself? Do you think you still need to work on a lot of things to
Yeah, I mean, I think I'll always feel that way. Um, there's a lot of feedback that we get from customers and members that helps us build to where we want to be. Like we're getting a lot of questions and requests for a toothpaste. So we're exploring a toothpaste line and just building out the brand to be what's known as the entity for prevention education for oral health. And that's an exciting space for me to be. Like, I think one day I'll wake up and say, I'm on to, the next thing, but there's so much more meat here that I want to work on. There's so much more expansion across the country. We're in all of the states right now with our kits, but I don't consider us just a product company. Like I want to be what people turn to and people recognize and associate with oral care, especially early on for families.
What kind of solutions did you find for your products in terms of manufacturing them? Did you did you get any kind of good deal, so to speak?
Yeah, I mean, honestly, when I first started and just had this as an idea as my side gig, I ordered 500 pieces of everything that goes in the kit. I was kitting them up myself to see if people even liked it. And then after each iteration of order, I would basically do a big focus group Q&A of what people liked, what people didn't, what they wanted to see more of, and reinvest a lot of the money that I got into building the brand, making more focus in that way. So at a certain point, you get a good deal on like MOQ or minimum order quantity, et cetera. At this point, we have thankfully an operations facility where I don't have to package them myself. But it took a long time to get there. And I obviously had to be strategic about it. And again, a lot of failures and flops along the way.
Yeah, it seems like everybody has those.
Yeah.
You can be successful without them.
Yes.
Um, and now you consider yourself um, a CEO of the company behind all the decisions. Do you want to have partners or you don't?
I think I'm definitely open to strategic partnerships. I think that's how you have to grow and move forward and become a visible name, et cetera. And we have a lot of amazing partnerships like that. Um, it depends on the agreement, honestly. I'm open to anything. I never say no. Like as an entrepreneur, I like to have everything on the table and just explore and be creative because I think that's where the best ideas come from.
Yeah, yeah. No, I asked that because, one of the main things for you, you're a young woman with kids, and I imagine you need your family lifetime.
Yeah.
How do you balance those things?
Yeah, I mean, it is so hard, don't get me wrong, two really young kids, and it really does take a village. And I take my job as a mom so seriously. So when I'm with my family, I need to be checked out. I'm not going to be on my phone and scrolling and dealing with business stuff. So I'm really intentional about making that split. But I have an amazingly helpful husband. We'll have a nanny occasionally. My son goes to school. So having this village to help take the load off and ensure that I know my kids are safe and learning and comfortable, all of that I'm really grateful for. And it makes me feel like I could be present in both roles.
That's awesome. I want to give you a scenario,
Sure.
kind of an exercise.
Sure.
If you would look yourself in the mirror when you were younger, with all the experience and failures and successes you've had so far, what kind of advice would you give to yourself?
Yeah, it's so cliche, but it's just the idea to keep going and to put blinders on towards your mission. Because I think, especially when we're young, we're so, I still feel this way occasionally, like insecure, wondering what people are thinking about you. But at the end of the day, when you put blinders on and think about your ultimate goal with your company or whatever personal goals and missions, you get this tunnel vision, and I think it always helps, and it drowns out the noise of what really doesn't matter.
Yeah, that's hard to do though, right? Because of all the distractions and I mean, I think it ultimately comes to discipline. And
Yeah.
I can't see an entrepreneur doing a successful job without being disciplined. Like you said, you're coming from a line of sportsmanship and training and athletic mindset that brought you to this place. But I'm trying to give a framework to someone who would like to do what you're doing, maybe not necessarily having the experience that you have. Um, what kind of advice would you have for someone that started like you and with no experience, maybe have an idea in any kind of medical domain? What would be the first few steps to take?
Yeah, I would say what's helpful is writing down a tangible list of your goals, because if you keep thinking in abstract ideas, how do you know if you've made progress? Like, you need to make goals. And I think it scared me to put goals down because I'm like, what if I don't reach them? It helps you build a path forward, and you won't do it without those goals. And I think you need to keep revisiting that. And we put a lot of pressure on ourselves to get everything done at once. If you get 1% better every day, at the end of the year, you are astronomically better. And you can look back on where you are a year ago and be like, look how much progress I've made. Even if that 1% is sending 5 cold emails, like, I consider that a win for me if I don't have the energy. And a lot of days I don't, because I'm so drained from my kids, frankly. And then 2 days later, you get a response from a cold email and you thank yourself and pat yourself on the back. So it's just thinking about what your future self would want. And again, that's cliche, but it's like you have to put the work in and be disciplined, and a little bit of work every day.
Yeah, the 1% rule, right?
Yeah.
That's what I said, right? It's funny how this works. Like, when you write down your goals and you put them in your mirror in the bathroom and you look, 5 days, 5 months, 5 years
Hmm.
later, you would be amazed how much you accomplished from those goals, right? The psychology of winning, I call it.
Yeah, that's exactly right. And I think you just need to remind yourself, because everything ebbs and flows. The highs come down, the downs come up. And especially in entrepreneurship, like, resilience is such a key characteristic. And maybe that ties back to being an athlete and being in sports, but like, you have to lose and get back up.
Yeah, very well said. So, Ashley, what's next with FirstGrin? What do you want to get to?
So we have a lot of travel coming up for in-person health tech conferences. We have some major partnerships we're announcing. Can't say anything yet, but stay tuned. Really excited. And then we're exploring and hashing out the products line. So super exciting. We're doing a lot of focus groups right now and seeing what that looks like. So 2026 is going to be busy, slammed, even the end of this year. So just feeling grateful and excited.
Very nice. And what's the final point here? Are you going to exit in any way? Do you want to exit? What do you want to do?
So we've had some companies come to us for exit proposals already. It feels a little early, to be honest. I think there's more work to be done. I want to build out the brand more. I want to build out the offerings more. Um, there are a bunch of opportunities for that, I would say. I think it makes sense to plug into some sort of broader company that's focused in the oral health space, whether that's a payer company, whether that's CPG. I think there are a lot of opportunities in both spaces.
Yeah, it's interesting. You mentioned toothpaste brand, right? You wanna build. I want to kind of get a little tangent on that
Yeah.
toothpaste issue because there's a lot of discussion lately in the media and health world about the making of the toothpaste and what are the advantages and disadvantages of using a toothpaste commercially right now. And what's your opinion on this?
Yeah, so fluoride's a very hot topic right now in public health. Fluoride's delivered in two ways: in the water, or in toothpaste. They help the teeth in separate ways. So it's a much stronger and effective way in toothpaste, undoubtedly. So yes, fluoride toothpaste guidelines say introduce as soon as the first tooth comes in, rice or smear size amount. Water, it really depends on a lot of factors based on weight, how much you're exposed to, and really a lot of your risk factors. But to answer your question, it comes down to it depends. And there's a lot of noise around toothpaste, over the counter, et cetera. And a lot of it's marketing, I will say.
Yeah. Yeah, some people marketing for sure. Some people, have I had some guests on my podcast with a lot of different conversation about toothpaste and with different conclusions. And I'm honestly very unconvinced of what's going on in the market right now, but definitely there's some good things and bad things about using a toothpaste or the way they make it right now,
Yes, completely agree.
Yeah, it's just the fact that they put that ADA warning message on the tube. It's like a little concerning, but we'll probably find out in a little while what's going on. Ashley, how can someone get in touch with you, maybe get some advice into the entrepreneurship ideas and mindset and to know more about your company?
Yeah, very reachable on LinkedIn. Also have my handle in the background here. It's at Pediatric Dentist Mom or at FirstGrin across all social medias, but definitely reach out. Super happy to help and connect with up and coming entrepreneurs, established entrepreneurs, whatever it may be. Like I'm always excited to explore new paths forward.
Awesome. I hope people will reach out and maybe just kind of poke into your little experience and mindset to learn more. I appreciate your time.
Thank you so much. Great conversation.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.